Hi, everybody. You can see that I live and work here, and I teach at the Arizona School of Dentistry and Oral Health. I'd like to invite you all back to Phoenix in December when it's a comfortable 75 degrees and we don't have any freakish thunderstorms. So, but while you're here, please enjoy this really lovely resort. So, you may be wondering why a dentist would be talking to you about bleeding and EDS. Well, dentists cause a lot of bleeding, and we need to know how to make it stop. And many years ago, I was working with people with HIV and hemophilia, which unfortunately were comorbid at the time. And I got very interested in working with people with bleeding disorders. On a personal level, my best friend in the whole world was diagnosed with von Willebrand's disease at the age of 19. Her children seemed to be asymptomatic. However, her grandson, who is adorable, was diagnosed at the age of 7 with hypermobile EDS. And after doing a lot of research and talking to my colleagues, I realized that my friend, who does definitely have a bleeding disorder, was most likely misdiagnosed with EDS, missing that somewhere along the line they missed it. While the mother of her grandson, her daughter, is asymptomatic, she is most definitely hypermobile. So, as I moved through the decades and became a specialist in orofacial pain, my interest in hypermobility spectrum disorders has become front and center to my practice. And where is the clicker? So, I have no disclosures, and we're all very familiar with this photo. And as we know, EDS is essentially a connective tissue disorder. And when the connective tissue or the glue that holds us together doesn't work, it affects every body system. And I love this slide. I love this picture because with most medical providers practicing in our individual silos, diagnosis can look like this, which is a bunch of blind people trying to figure out what an elephant is. So let's talk a little bit about easy bruising and bleeding. It is a very prominent feature, as I'm sure you all know, in EDS and other collagen disorders. And very often it presents as the most concerning symptom. And it occurs in all types of EDS, and it can be caused by a whole bunch of different things like coagulation factor deficiency, platelet dysfunction, mast cell activation disease, and even acquired von Willebrand disease. Unfortunately, in my line of work, I've been the medical provider to first recognize a bleeding disorder with concurrent hypermobility syndromes. And I want to stop for a minute and have you all think about the role that chronic inflammation plays in exacerbating EDS symptoms. We're going to get back to this in a minute, but keep in mind that the most prevalent inflammatory disease on the planet is periodontal disease. So, there's lots of different types of bleeding problems, and they range from the annoying to the life-threatening. But if you look at the last 4 or 5 bullet points on this slide, the perioperative hemorrhage, the heavy menstrual periods, the gingival bleeding, the nosebleeds, and the easy bruising, that's the exact same symptom profile that we see with von Willebrand's disease. So, getting back to periodontal disease. It is, as I said, the most prevalent inflammatory, chronic, infectious disease on the planet. And the oral cavity, I need to remind you, is not Las Vegas. What goes on there does not stay there. Okay, so the bacteria specific to periodontal disease is also found in the arteries of people who've died of heart attacks. We found them in the joints of people with rheumatoid arthritis and other autoimmune disorders. They play a definite causative role in the development of type 2 diabetes. And as with any chronic inflammatory disease, it changes your blood chemistry, which is constantly trying to fight the infection, and it's a losing battle. So floss every day, but that's a different topic. And for those of you who have mobility issues, there's lots of different products out there that can help you achieve the goal of getting those bacteria out of that little space between your teeth and your gum where they like to live, and any one of you can contact me about that. So, collagen. It's a group of proteins. It's essential for development and organ development when we're fetuses. It's essential for cells to attach to each other, platelet aggregation. We all know too well that it provides tensile strength to the connective tissue in bone, skin, ligaments, and tendons. And we know that it's altered in lots of different types of Ehlers-Danlos. So we know that bleeding disorders and hypermobility disorders occur together. The jury is still out on whether or not it's coincidence or comorbid. We know that patients in bleeding disorder clinics have a higher prevalence of joint hypermobility, which again leads to misdiagnosis, and the converse. A lot of hypermobile patients report symptoms of easy bruising and abnormal bleeding, which also leads to misdiagnosis. So it's important as practitioners that when we diagnose someone with a bleeding disorder, if there's any hematologists here or friends of hematologists, that we evaluate for collagen disorders. By the same token, anyone with a hypermobility disorder should be evaluated for platelet disorders or other bleeding disorders. Again, coordinating care among providers is a really important topic, and we've covered that a lot during this meeting. And I can tell you, as a dentist who treats people with both disorders, that they occur together far more often than, at least in my humble opinion, is coincidence. So the misdiagnosis can get frustrating, and more work needs to be done in this area. So let's talk a little bit about the role of collagen and von Willebrand factor, which is a big, beautiful, very busy molecule. So when a blood vessel is damaged, there are lots of places that this can go wrong. Von Willebrand factor initially interacts with different types of collagen and adheres to them. First place where something can go wrong. The von Willebrand factor changes shape, which allows the platelets to bind to it, and this forms the initial blood clot or platelet plug. We have seen that collagen obtained from patients with EDS show decreased ability to aggregate platelets when compared to controls, but again, there's limited research in this area. Just remember that it's a really complex process, and there's a lot of places for it to go wrong. Oops, let's see if we can go back. This is just a picture of how it works. You have injured blood vessel, and the von Willebrand factor initially adheres, hopefully, to the collagen, which in turn allows platelets to adhere and initially stop the bleeding. So, more about platelet dysfunction in EDS. There's been very little research in the area. Abnormalities in platelet structure in patients with EDS have been described, but only proven for sure in vascular EDS. A lot more research needs to be done in this area. Oops. And that's a pretty little picture of platelets, those round donut-shaped little things. I love looking at pictures of molecules and things like that, which is why I guess I'm a nerd, but anyway. So again, just a brief hemostasis review, and it's really complicated, and honestly, we still don't understand it all. So there's a vessel injury, and the platelets stick to the von Willebrand factor, as I said, and the collagen fibrils. And the smooth muscle constricts a little bit to stop the bleeding, and that's another whole pathway. And then we begin to get clotting factors that activate each other in this very complicated cascade to produce thrombin, which in turn activates fibrinogen to make a blood clot, and those little scabs that we have. And the speaker before me talked in detail about how sometimes this results in scarring in our populations. And there are a lot of components in platelets that we don't quite understand how they do it, but they direct wound healing. So, von Willebrand disease, factor deficiencies, and Ehlers-Danlos syndrome. Von Willebrand disease is pretty common. It's estimated to affect about 1 to 2% of people worldwide with no gender, ethnic, or other preference. It's a very democratic disease. And there are numerous variants and phenotypes, and that's a 2-day lecture in itself. But when it co-occurs in someone with EDS, it definitely causes more severe bleeding problem. And other interesting bleeding disorders that occur with EDS are mild hemophilia A, which is factor 8 deficiency, factor 7 deficiency, factor 11, and factor 13 deficiency. And trust me, most people who go to medical and dental school don't even memorize this whole coagulation cascade. It's really complicated. So don't worry about it. Just know that a lot of things can go wrong. So we're all too familiar with mast cell activation disorders, and that also plays a role in bleeding. So we know that mast cells play, in normal times, play a role in allergies. They tend to collect, they like to hang out near nerve endings, blood vessels, and lymphatics, and that creates many levels of chaos. And that can result in neuropathies. They're all listed here. I have a patient who has hypermobile EDS, and her mast cell disease is so serious that she has something called allodynia. It's a type of neuropathy where just normal touch is painful. And I don't know if any of the rest of you out here experience that, where normal touch or slightly, a little bit of pressure is painful. And her mast cell disease is so bad that we can't even use typical techniques for treating her facial pain. And those include acupuncture, trigger point injections, massage. I actually had her come up to the school where we have this really fancy $40,000 laser that theoretically can loosen up the trigger points that cause the muscle aches. She's been having a little bit of success with it. Hopefully there'll be some more research in that area, and that will soon be another treatment modality for people with these types of conditions. So, getting a little bit more into the weeds, the relationship again between coagulation and mast cell activation is really complicated. So tryptase is one of the enzymes that are released from mast cells when they're activated. And going back to the coagulation cascade, they interfere with blood clot formation, and that, of course, can worsen bleeding. They also release a whole lot of other molecules like heparin, histamine, and serotonin. Heparin is actually thought to regulate mast cells, but it's also a very potent blood thinner. Serotonin is a mood stabilizer in the central nervous system, but in the periphery, it's heavily involved in the coagulation process. It happens that people with bleeding disorders like hemophilia or von Willebrand disease are advised not to take SSRIs, which are very common antidepressants, because they can exacerbate a bleeding problem. They also, by the way, and this is a little off topic, one of the side effects is bruxism and clenching your teeth. Not a great thing to do if you have EDS. And the SSRIs, fluoxetine, sertraline, paroxetine, citalopram. I would recommend that if excessive bleeding is part of your symptom profile, you talk to your provider about switching. SNRIs are really good at dealing with depression. They also have an analgesic effect, which can reduce chronic pain, and they don't have the bleeding profile that the SSRIs have. So we know that multiple organs are involved in mast cell activation disease. And if we try to treat the bleeding associated with it, some common methods of treating hemorrhage or uncontrollable bleeding are infusions with fresh frozen plasma, platelet transfusions, vitamin K, and this usually doesn't work because of the degranulation of the mast cells and the hyperactivity. So we have to find other ways to control it, and that could be a variety of mast cell mediator blockers, stabilizers, and steroids. And please tell your dentist if you have this disorder. I will guarantee that your dentist has never heard of it. So make sure that your dentist is in contact with the people treating, and very often it's a lot of people. But make sure your dentist is in contact with your primary health care provider. Whoops. Where am I? We did that one already. It's terrible being this short behind a podium. I can't see anything I'm doing. Treatment options. So a lot of folks think that vitamin C improves collagen strength. And while vitamin C is wonderful, there's no good evidence that it improves symptoms in EDS. DDAVP, or desmopressin, is a medicine that we use quite commonly in people with bleeding disorders. It increases the number of von Willebrand factor molecules from cells, and it can be administered intranasally, which is really easy. You just got to shoot a couple of things up your nose, or intravenously. There's definitely good evidence to show that there's a higher incidence of bleeding complications following dental procedures in patients with hypermobile EDS. I think it's very reasonable to use DDAVP in these cases. Your dentist, I don't think there's any state where it's within the scope of dentistry to prescribe DDAVP, so that would have to be in conjunction with a hematologist or your primary medical care provider. You need to be careful in elderly patients for a whole bunch of reasons. Tranexamic acid was mentioned earlier. Tranexamic acid and Amicor are both medications that interfere with bleeding in different steps of that complicated thing. Tranexamic acid, it's also available as a pill or intravenously, and it is approved for dental extractions in the United States for people with bleeding disorders. In many countries, it's used topically, and hopefully the FDA will approve the topical use sometime soon in the United States. It would make life a lot easier for all of us. One of the tricks I use in my office is I'll have patients bring some Amicor, which comes in syrup form, to the appointment. It tastes horrible, but if I can soak a gauze with it and just put it on a bleeding extraction site or any other site where I've done some surgery, it really does a nice job of controlling bleeding, and it's a great tool to have on hand if you have a bleeding issue. So this slide shows the different medical homes for hypermobile patients, and what it does is show just how multi-symptomatic this disease is and how many different providers treat it. It's really important that we increase the percentage of people in that multidisciplinary group. And I want to talk for a minute about hemophilia treatment centers. I'm really involved with them, and they were established by the CDC back in the 1970s. as a model medical home for people with bleeding disorders. And under one roof, people with bleeding disorders get all the care they need, hematology, nutrition, physical therapy, behavioral health. And we really need to be looking at that as a model for people with EDS and hypermobility disorders, and it's something we should work towards in the future. I want to switch now to iron deficiency and anemia. It's a real problem. The global burden of iron deficiency is up to 30% in adults, particularly the elderly in the US. In women, it's 10.4%. Women with abnormal uterine bleeding, it's up to 50%. Iron deficiency in a pregnant woman or in a young child has been linked to decreased overall IQ. That data is a little sketchy because it can be confounded by socioeconomic status. We need iron just in the right amount, not too much, not too little. And when iron homeostasis is functioning properly, between 1 and 2 milligrams a day is absorbed and lost. All right, once again. Okay. So usually when computers see me coming, they just die a quick death on their own. Rather than go through the slow death I put them through, so bear with me. You know, I come from phones with party lines and long twisty cords and 3 channels and stuff like that. So let me close with a case report about Sally. She was a 32-year-old female who presented to my orofacial pain clinic for an evaluation. Her chief complaint was, and I'm sure some of you out there have heard this or felt it. The right jaw is stiff in the morning. It locks closed many times throughout the day. The jaw pain turns into a headache, which travels up the side of my face to my forehead and temple area. And I'm also having neck pain. So her medical history, she stated that she's double jointed. She has chronic body aches and trouble concentrating. She also told me in the workup that I do on all my patients that she's fatigued from restless legs at night, and she wakes up every morning with bruises all over her legs. I wish I had a picture to show you. She's talking 40 or 50 bruises on each leg. She suffers from chronic migraine and tension-type headache. She also reports heavy menses, prolonged bleeding, especially with previous dental extractions, which I can attest to. So my diagnosis was a whole compilation of various temporomandibular dysfunctions, but there's something else going on, and it's important to remember that restless leg syndrome is strongly associated with iron deficiency anemia. So that's just an example of my skills with computers and things like that. So that's a slide I just went over. So her treatment plan was our standard non-invasive therapy, but mindful of the fact that I strongly believe she has EDS, I avoided some of the trigger points. I referred her back to her primary care physician for blood work because of the limb movement disorder. The blood work came back normal and told her there was nothing wrong and threw in a couple of wisecracks about me, which resulted in, I'm originally from Brooklyn and I spent most of my adult life in New Jersey. So I went full New Jersey on this guy when I called him. He didn't have a good day. So there is a hematologist in Phoenix who is world famous. She herself has hemophilia, and I am proud to call her a friend and a colleague. I called her nicely but persuasively and begged her to see the patient, which she did. So her hematology consult went something like this. Her hemoglobin was normal, which is why the PCP told her there was nothing wrong with her. But her ferritin stores, ferritin is the way we measure stored iron. Iron is essential for life. Iron is what carries oxygen to every cell in our body. And when blood cells start to feel like they're getting low on iron, they will steal it from the liver and the muscles where it's stored. Ferritin measures the stored iron, and when that's low, that's an indication that there's something really wrong. So in the United States, 11 is considered within normal limits, but most hematologists think that 50 is kind of a baseline. Her bleeding time was prolonged and her factor VII activity was low. So, in summary, this 32-year-old female presented to an orofacial pain clinic with fatigue and bruising, and together with my hematology colleagues, we were able to diagnose the underlying causes of her pain, and were able to work together to manage her symptoms. Turns out she was unable to digest iron in her diet, which happens to be something we notice in people with EDS. We put her on iron infusions, and a lot of her pain, I mean, she's like a different person now. She still has a little bit of pain, but she's functioning, she's normal, she's healthy, and she's happy, and she has her diagnosis of hypermobile EDS, and she's being treated properly. So, in summary, teamwork is the dream work, and thank you so much for listening.